Good afternoon. I am Abhishek Mukhopadhyay and with me is Prashant Kumar Sinha with the Midday News. The headlines. Evacuation operation Vande Bharat mission is in full swing by air and sea on the fourth day today. INS Jalashwa reaches Kochi from Malé with 698 stranded Indian nationals on board. Naval ship Kesari departs for Maldives, Mauritius, Madagascar, Comoros and Seychelles with medical teams and essential goods. Health Ministry to deploy central teams to 10 states with high spurt of COVID-19 cases. ICMR says a total of 16,09,037 samples of COVID-19 have been tested so far. Recovery rate stands nearly 30%. And National Disaster Management Authority issues guidelines for restart of manufacturing industries after the lockdown. The massive evacuation operation Vande Bharat mission to bring back stranded Indian nationals from several countries due to coronavirus outbreak continues in full swing on the fourth day today. Under the mission, thousands of Indians stuck in different parts of the world have been brought back by air and sea. As part of Samudra Setu program under Vande Bharat mission, the naval ship INS Jalashwa arrived at Cochin port this morning carrying 698 persons evacuated from Maldives. The group comprises 595 males and 103 females. A report.
INS Jalashwa entered the Kochi harbour today morning at 9:30 a.m. The passengers were disembarked at the Samudrika cruise terminal in Kochi. The group included 19 pregnant women and 14 children aged below 10 years. The detailed medical checkup of all the passengers were conducted by the special medical team of Port Trust. Passengers showing COVID symptoms were sent to the Ernakulam Medical College Hospital and other critically ill people were shifted to the Port Trust Hospital. Those passengers who did not show any symptoms were sent to the state quarantine centres in respective districts in specially arranged KSRTC buses and taxis. Meanwhile, 2 more flights are scheduled to arrive in Kerala today carrying stranded people from abroad. Flight from Doha will be arriving in Thiruvananthapuram at 10 p.m. and flight from Kuala Lumpur is scheduled to reach Kochi at 10:50 p.m. today. Mayusha for AR News from Thiruvananthapuram.
The special flight under the Vande Bharat mission arrived from Singapore at Mumbai's Chhatrapati Shivaji Maharaj International Airport this afternoon. Earlier in the wee hours, the special flight brought back 239 stranded Indian nationals from London. More in this report.
A total of 243 stranded passengers were brought back from Singapore this afternoon in a special flight under the Vande Bharat mission. Later at night, a special flight is scheduled to arrive from Manila at the Mumbai airport, bringing back Indian nationals stranded there. Upon the arrival, the passengers have been asked to download the Arogya Setu app on their mobile devices on local SIM. All the passengers will then be quarantined at paid facility for a period of 14 days. The Mumbai civic body has already identified these facilities where the passengers can be quarantined. During the quarantine period, all passengers will be regularly checked by the district or the civic body officials as per the protocol. Meanwhile, 2 special Shramik trains carrying over 1100 migrant labourers each left Pune and Nagpur late last night. Kunal Shinde, AIR News, Mumbai.
India has sent Indian naval ship Kesari to Maldives, Mauritius, Madagascar, Comoros and Seychelles, carrying on board 2 medical assistance teams, consignments of COVID-related essential medicines and essential food items. The External Affairs Ministry said in a statement that this was in response to requests by the countries for assistance in dealing with the pandemic. The medical assistance teams will be deployed in Mauritius and Comoros and help the governments deal with the COVID emergency and dengue fever. The ship will deliver consignments of COVID-related essential medicines to Mauritius, Madagascar, Comoros and Seychelles and about 600 tons of food items to Maldives. In addition, in case of Mauritius, a special consignment of Ayurvedic medicines is also being sent. The consignments meant for Madagascar and Comoros also include hydroxychloroquine tablets, which have already been sent earlier to Mauritius, Maldives and Seychelles. In line with its time-tested role as the first responder in the region, India has already supported Maldives, Sri Lanka, Mauritius and Seychelles by providing them consignments of COVID-19 related essential medicines. Mission Sagar is inspired by the Prime Minister's vision of Sagar security and growth for all in the region.
A Vande Bharat mission flight is set to reach Chennai this afternoon, carrying about 200 stranded Indians in Kuwait. Last night, a flight from Kuala Lumpur reached Trichy Airport in Tamil Nadu, repatriating 177 people as part of the largest Indian evacuation mission.
In a positive development, the production lines of several large and small-scale industrial units in Tamil Nadu have gradually gained steam to carry forward their operations. As the units outside containment zones have been permitted to resume their activities with limited strength, major industrial houses have brought their production lines back on track. The Korean auto major Hyundai has begun firing on all cylinders and has rolled out 200 cars from its Sriperumbudur facility near Chennai on the first day of resuming its production last Thursday. Similarly, the German luxury car maker BMW, Eicher Motors, auto and ancillary players like TVS Group companies and MRF are some others in the state who have resumed operations by following the safety protocols. The process of reopening the economy has got accelerated with the auto majors bringing their production facilities back to life. Jai Singh, AR News, Chennai.
Indian Railways have operated over 300 Shramik special trains across the country till date. Railways had decided to operate Shramik special trains after Home Ministry's order regarding movement of migrant workers, pilgrims, tourists, students and other persons stranded at different places by special trains. These trains brought back migrant workers to various states including Andhra Pradesh, Bihar, Uttar Pradesh, Himachal Pradesh, Jharkhand, Madhya Pradesh and West Bengal. A report.
Since the announcement of nationwide lockdown, Indian Railways has consistently proved itself to be the true lifeline for the nation. They are of course not plying the normal passenger train services, but are certainly ferrying stranded migrant workers back to their home cities. Amidst the lockdown, the trains have ferried people to cities like Prayagraj, Chhapra, Balia, Gaya, Purnia, Varanasi, Lucknow and many more. A maximum of around 1,200 passengers are allowed to travel in one such Shramik special train, observing strict social distancing norms. Proper screening of passengers is ensured before boarding the train. Railways is also providing the passengers free meals and water during the journey. Railway nodal officers in various states are coordinating with the state government representatives constantly as their concurrence is necessary for movement of such passenger trains. The efforts are ongoing and stranded people who wish to travel have been requested to register themselves with the state government. Anand Chaturvedi, AIR News, Delhi.
In Tamil Nadu, a batch of 962 workers belonging to various districts of the state were brought back by Shramik special train to the central city of Trichy this morning. These people were engaged in labour in the Maharashtra town of Sholapur, well known for handcrafted eco-friendly slippers. The workers were taken to their native district by 30 special buses of the State Transport Corporation from the Trichy railway station. They were provided with free food packets, drinking water and face masks by the concerned district administration. Special efforts were taken to ensure social distancing norms and hygienic practices amongst the workers during the journey period. In Uttar Pradesh, Chief Minister Yogi Adityanath has again appealed to migrant workers in other states not to travel on foot, by bike, truck or any other vehicle to Uttar Pradesh. He said that the Uttar Pradesh government is managing and making all efforts to bring them back safely and respectfully. Mr. Yogi expressed deep sorrow on the death of migrant workers of Uttar Pradesh in Narsinghpur of Madhya Pradesh in a road accident. Our correspondent reports that the Uttar Pradesh government is bringing back stranded migrant workers by special trains to the state. As of now, more than 114 trains have reached the state with more than 120,000 migrant labourers.
The Health Ministry has decided to deploy central teams to 10 states that are witnessing high caseload and high spurt of COVID-19 cases. The teams will assist the state health departments to facilitate management of COVID-19 outbreak. The states are Gujarat, Tamil Nadu, Uttar Pradesh, Delhi, Rajasthan, Madhya Pradesh, Punjab, West Bengal, Andhra Pradesh and Telangana. Our correspondent has the details.
The central teams are comprised of a senior official from the Health Ministry, a joint secretary level nodal officer and a public health expert. They will support the state health department in implementation of containment measures in the affected areas. These teams are besides the 20 central teams of public health experts who were earlier sent to the high caseload districts. A high-level team had recently been deputed to Mumbai to support the state efforts in COVID-19 response and management. With Divakar, Suparna Saikya, AIR News, Delhi.
Percentage of patients cured of coronavirus infection is improving day by day. The total confirmed cases of coronavirus infected persons across the country have reached to 62,939. Out of these, 19,358 patients have cured so far, taking the overall recovery rate to 30.75%. More from our correspondent.
On 25th March, when the lockdown was enforced across the India, 43 patients were cured from coronavirus, which was 7% of the total 606 cases. Health and Family Welfare Ministry data reveals that highest recovery rate of 100% have been recorded in Andaman and Nicobar Island, Arunachal Pradesh, Goa, Manipur and Mizoram. Kerala, which was leading the tally in the initial stage of the coronavirus outbreak in the country, now stands at 96% recovery rate. There are 24 states and union territories in the country which are above the national recovery rate of 30.75%. Bhupen Singh, Air News, Delhi.
In Delhi, 75% of COVID-19 cases are asymptomatic or with mild symptoms. The Delhi government has made arrangements for treatment of those at their homes with mild symptoms. Briefing media, Chief Minister Arvind Kejriwal said out of roughly 7,000 positive cases in Delhi, around 1,500 are in hospital. Out of those in hospital, only 27 are on ventilator. He said it has been found during analysis that 82% of the people who have lost their lives were above the age of 50 years. He urged people to take care of elderly persons. In Uttar Pradesh, the state government is taking all steps to contain COVID-19. The recovery rate of corona patients in Uttar Pradesh is higher than the national average tally of recovery. More from our correspondent.
Principal Secretary Health Amit Mohan Prasad told that the recovery rate of COVID-19 patients in the state is 43%, which is 13% higher than the national index. Total number of corona cases has reached 3,266 in 68 districts in the state. There are more than 1,800 active cases in 62 districts and 1,399 COVID-19 patients have got cured and discharged so far. The total number of COVID-19 testing labs in the state is being increased and presently there are 26 labs including government and private sector. As of now, 1,24,791 tests have been done for coronavirus. The total number of beds for corona patients has reached 53,459 in L1, L2 and L3 hospitals. MS Yadav, Yaya News, Lucknow.
In Bihar, the number of positive cases of coronavirus infection has gone up to 629 with reporting of 18 fresh cases today. 5 people so far died due to corona. Around 140 migrant workers have tested positive for corona. Number of cured patients has gone up to 330 with discharge of 8 patients from hospitals today. In all, 294 are undergoing treatment in different hospitals. The recovery rate has gone up to 52.5%. Director of All India Institute of Medical Sciences, Delhi, Dr. Randeep Guleria has said that late hospitalization of COVID-19 patients due to fear of stigma and higher prevalence of comorbid conditions were key reasons behind the high number of COVID-19 deaths in Gujarat. He was speaking to media last evening after a day-long visit to Ahmedabad for reviewing COVID-19 facilities and treatment. He said Gujarat is following standard protocols which are at par with those followed in AIIMS. He said that people in Gujarat are reporting late in hospitals due to stigma of fear which adversely impacts their treatment outcome. Dr. Guleria said that COVID-19 patients should regularly consult doctors to ensure their oxygen levels are maintained. The AIIMS director said the presence of comorbidities was another factor behind higher casualties in the state. He said that patients with diabetes, hypertension, heart and kidney ailments deteriorate faster. It is advised that such patients be looked after aggressively in high dependency units.
2 or 3 things have emerged. One is that there is still, as is happening in many states, a stigma which is still attached to COVID-19, and I would really urge that the media also helps us to sort of get or destigmatize the fear and stigma with COVID. What is happening is many patients, because of the fear that they will get positive and it will create a bad name or they will get all quarantined, तो उससे ये हो जाता है कि जब वो पॉजिटिव हैं और वो देर से आते हैं तो उससे मोर्टेलिटी बढ़ जाती है. ये समझना बहुत जरूरी है कि कई दफा जो पेशेंट्स को माइल्ड प्रॉब्लम है, माइल्ड सिम्टम्स हैं, लेकिन उनकी ऑक्सीजन कम हो सकती है और एक टर्मिनोलॉजी वेस्ट में यूज की है जिसका नाम है हैप्पी हाइपोक्सिया. तो उनको पता नहीं कि उनकी ऑक्सीजन कम हो रही है, वो उनको कोई सिम्टम नहीं है, लेकिन ब्लड में ऑक्सीजन कम हो रहा है और अगर उनको ऑक्सीजन मिल जाएगी तो उनकी लाइफ सेव हो सकती है. लेकिन वो हॉस्पिटल नहीं आ रहे हैं, ऑक्सीजन बहुत क्रिटिकली लो हो रही है, जिससे हार्ट पे असर पड़ रहा है और ऑर्गन्स पे असर पड़ रहा है और इससे डेथ के चांसेस बढ़ जाते हैं.
According to State Health Department, total number of COVID-19 cases has gone up to 7,797 with 394 more cases recorded in the last 24 hours. Dr. Jayanti Ravi, Principal Secretary of Health and Family Welfare Department, said that Gujarat will follow national guidelines for discharge of positive patients. She said that the new protocol would not need the two negative RT-PCR tests.
अगर डिस्चार्ज और रिकवरी रेट का टकावारी प्रतिशत अगर हम देखें तो पिछले 15 दिन में इसमें 457% बढ़ोतरी हुई है. ये भी बहुत अच्छी बात है. इसी तरह से अगर हम आज जितने पेशेंट्स एक्टिव हैं, 5,210 ऐसे लोग हैं कि जो स्टेबल हैं, 24 ऐसे लोग हैं कि जो क्रिटिकल हैं, वेंटिलेटर पर हैं और 219 लोगों को भी गिनती में लेते हुए आज तक 2,091 लोग डिस्चार्ज होकर वापस घर चले गए. 2091. तो ये 2000 का मार्क भी आज हमने क्रॉस किया है. ये भी बहुत बड़ी बात है.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Evacuation operation Vande Bharat mission is in full swing by air and sea on the fourth day today. INS Jalashwa reaches Kochi from Malé with 698 stranded Indian nationals on board. Naval ship Kesari departs for Maldives, Mauritius, Madagascar, Comoros and Seychelles with medical teams and essential goods. Health Ministry to deploy central teams to 10 states with high spurt of COVID-19 cases. ICMR says a total of 16,09,037 samples of COVID-19 have been tested so far. Recovery rate stands at nearly 30%. National Disaster Management Authority issues guidelines for restart of manufacturing industries after the lockdown. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
Indian Council of Medical Research, ICMR, has said that a total of 16,09,037 samples of COVID-19 have been tested by the various government and private laboratories in the country so far. Yesterday, 85,824 tests were conducted. Meanwhile, ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. As of now, 343 government laboratories and 129 private laboratories chains have been given approval to conduct the test for COVID-19. National Disaster Management Authority, NDMA, has issued guidelines for restart of manufacturing industries after the lockdown. In its guidelines, NDMA said state governments will ensure that off-site disaster management plan of the respective major accidental hazard units are up to date and preparedness to implement them is high. It is also advised that all the responsible officers of the district will ensure that the industrial on-site disaster management plans are also in place and cover standard operating procedures for the safe restarting of the industries during and after COVID-19 lockdown. In the guidelines, the NDMA has advised the manufacturing industries to consider the first week as trial or test run period while restarting the unit and ensure all safety protocols and not try to achieve high production targets. It said to minimize the risk, it is important that employees who work on specific equipments are sensitized. They made aware of the need of identity, abnormalities like strange sound or smell, leaks, smoke or other potentially hazardous sign which indicate the need for immediate maintenance or if required shutdown. It has suggested for inspection of all equipments as per the safety protocols during the restart phase. The authority also said in case the industry has any difficulty in managing crucial backward linkages that may be critical for the safe functioning, they should approach the local district administration for specific assistance. For workers, the NDMA in its guidelines has advised for 24 hours sanitization of the factory premises. For entrance health checks, it said temperature checks of all employees should be done twice a day and workers showing symptoms should not report to work. Gloves, masks and hand sanitizers should be provided at all factories and manufacturing units. On COVID-19 health and prevention, staff education, it said, education on safety steps to take from entry to exit in the factory.
In our series Expert Speak on All India Radio, we bring you the views of some leading medical experts on COVID-19. Talking to AIR News, Dr. Amarchand Bajaj, Senior Consultant at the Sitaram Bhartiya Institute of Science and Technology, New Delhi, highlighted the importance of hygiene and how to maintain it to contain the virus.
जब तक हमारे पास इनकी ट्रीटमेंट वैक्सीन या मेडिसिन के रूप में ना निकले तब तक हमें जो प्रिकॉशनरी मेजर्स है वो फॉलो करने हैं। जहां जरूरत ना हो उसमें घर से बिल्कुल बाहर ना निकले, कोशिश करें कम से कम बाहर निकलना है। और जबकि निकलना भी पड़ा घर से बाहर तो कोशिश करें कि जहां आप 2 लोग खड़े हैं करीब 2 मीटर दूर खड़े रहें, नहीं तो कम से कम 1 मीटर दूर खड़े रहें।
Talking to AIR News, Dr. Naresh Gupta of LNJP Hospital, Delhi said that in most of the cases, the COVID-19 infections are self-limiting and very few patients are required to take admission in hospitals.
पहले हम क्वारंटीन में भी सरकारी जगह पे रखते थे, फिर कहा कि सबको क्वारंटीन सरकारी जगह पे रखने की जरूरत नहीं है, जो लोग घर पे मैनेज कर सकते हैं वो मैनेज कर लें। अब दाखिले में भी 3 तरह की कैटेगरी होती थी, जो हल्के फुल्के केस होते थे जिसको माइल्ड केस कहते हैं, उनको जो 2 हफ्ते रखते थे, अब कहा कि नहीं, हम उनको अब 10 दिन के बाद जो है कुछ छुट्टी कर सकते हैं, बशर्ते कि वो 3 दिन बिना बुखार के हैं। उसके आगे का 1 हफ्ता वो घर पे अपना एहतियात रखेंगे और अपने आप को आइसोलेट करके रखेंगे। तो उससे काफी हद तक, क्योंकि मेजॉरिटी केस जो है 60% केसेस में होते हैं, जब वो वहां जाएंगे तो फैमिली को, समाज को भी कॉन्फिडेंस आएगा।
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and mythbusters. The government has rejected an audio message shared on social media claiming that the centre is giving 3 lakh rupees per COVID-19 patient to states to look after patients. It has termed the claim as false and baseless. The Union Health Ministry has clarified that there is no such scheme by the central government.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. Tanmaya Talukdar, Professor and AMP, Head, Department of TB and Chest Diseases, Pulmonary Medicine will participate in the discussion. Listeners can ask questions to the expert on toll-free telephone number 1800115767. I repeat, 1800115767. You can also ask questions on telephone number 011-2331-4444. I repeat, 011-2331-4444 and post queries on our Twitter handle @AIR News Alerts by #AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. Union Minister for Development of North-Eastern Region Dr. Jitendra Singh today clarified that North-East students of Delhi University will not have to vacate the hostel in view of lockdown. In a tweet, he said the issue that arose last night as a result of eviction notice to some of them to leave the hostel has been sorted out.
An earthquake of magnitude 3.5 on the Richter scale shook parts of the national capital this afternoon. No loss of life or property has been reported. India's national broadcasters Doordarshan and All India Radio have assumed focus on comprehensive weather coverage from across the entire territory of the country. The weather reports cover details from every corner of the country, highlighting extreme weather conditions, temperatures of various places from Kashmir to Kanyakumari, Gilgit to Guwahati and Baltistan to Port Blair. A report.
To begin with, the national capital Delhi, temperature here will be 40 degrees Celsius today and the city will witness partly cloudy sky with possibility of thunder with lightning. Mumbai will have mainly clear sky with maximum temperature of 35 degrees Celsius. In Kolkata, maximum temperature will be 36 degrees Celsius. City will witness rain or thunder showers with strong gusty winds. Chennai will experience partly cloudy sky today with the maximum temperature settling at 37 degrees Celsius. Moving over to northern parts, Jammu is going to experience partly cloudy sky with 1 or 2 spells of rain or thunder showers. The maximum temperature is likely to be 35 degrees Celsius. Srinagar is likely to witness partly cloudy sky with a possibility of rain or thunderstorm or dust storm. Maximum temperature is likely to be around 23 degrees Celsius. Forecast for Gilgit says it is likely to face generally cloudy sky with light rain. Maximum temperature here will hover around 29 degrees Celsius and minimum temperature will settle at 19 degrees Celsius. Muzaffarabad will also experience generally cloudy sky with light rain today. Maximum temperature will settle at 21 degrees Celsius. Tripti Srivastav, AIR News, Delhi.
Mother's Day has been celebrated in many parts of the world today. The day is celebrated on the second Sunday of May and dedicated to the bond between the mother and the child, which is one of the most amazing relationships on this planet. We leave you with 2 songs expressing gratitude to the mothers. Implementation of lockdown across the country, various departments of the central and state governments have coordinated to help a senior citizen in distress to reach a home travelling over 1,300 kilometers through 4 states. Lalita Maladi, a senior citizen, is one of the passengers who arrived in Mumbai International Airport from the US by the last flight before lockdown. She had to mandatorily quarantine herself at a hotel for 14 days. She had to reach a home in Chennai to attend to her husband, who is suffering from cancer, when the entire nation was locked down. She was held up for another 15 days in Mumbai due to lockdown. The central government coordinated with all concerned departments of 4 states, including Maharashtra, Karnataka, Andhra Pradesh and Tamil Nadu. Ms. Lalita thanked the government, saying, but for its help, she would not have reached Chennai even after 1 month of her arrival.
The Mysuru-based Central Food Technological Research Institute, CFTRI, has developed spirulina groundnut chicky that can provide micronutrients and boost immunity of people during this time of pandemic. More on this from our correspondent.
The Central Food Technological Research Institute has come out with a snack that provides good micronutrients. It has used spirulina as well as the tasty, nourishing groundnuts to prepare chicky that is rich in micronutrients such as vitamin A, carotene, and easily digestible algal proteins. The director of CFTRI, Dr. KSMS Raghav Rao, spoke to AIR about the benefits of spirulina chicky.
Spirulina is a freshwater algae, a microscopic plant which grows in standing water. It is a good source of nutrient, and so CFTR has been working on it for several years. In fact, CFTR developed technology for pure culture of the algae. To grow only spirulina needs skills of controlling the temperature, fertilizer and oxygen level in water. The color and taste of it is not very appealing. Therefore, it is usually given as a capsule. We have been trying to use it with other snack items so that the benefits of spirulina can be reached to even those who do not relish it. One of those snacks is spirulina chicky.
The Income Tax Department of Karnataka and Goa region has distributed 500 kgs of CFTRI chickies to migrant labourers in Bengaluru and surrounding areas. Other nutritious snacks of CFTRI such as Nutri Mango Fruit Bar and cardamom flavoured water is also part of the food items supplied to the migrant labourers. The mango bar is rich with carbohydrates, carotene, vitamin C and zinc to improve the immunity. Cardamom flavoured water with traditional herbs too have immune booster qualities. With Nanjunta Swami from Mysuru, this is Sudhindra for AIR News, Bengaluru.
More than 4 million confirmed cases of coronavirus have been reported around the world, according to data collated by the Johns Hopkins University. The global death toll has also risen to 277,000. The US remains the worst hit country, accounting for over a quarter of confirmed cases.
And now, before we end the bulletin, the headlines once again. Evacuation operation Vande Bharat mission is in full swing by air and sea on the 4th day today. INS Jalashwa reaches Kochi from Malé with 698 stranded Indian nationals on board. Naval ship Kesari departs for Maldives, Mauritius, Madagascar, Comoros and Seychelles with medical teams and essential goods. Health Ministry to deploy central teams to 10 states with high spurt of COVID-19 cases. ICMR says a total of 16,09,037 samples of COVID-19 have been tested so far. Recovery rate stands nearly 30%. And National Disaster Management Authority issues guidelines for restart of manufacturing industries after the lockdown. And with that, we end the Midday News.